Hey everyone, it's Dr. Russ. Today we're going to make our feet strong. For this you're going to need a few things. A TheraBand, I like red. Foam roller, this is a short one, just makes it a little easier. If you have a long one, that's fine. And an object about yay big, and you're going to need about 20 minutes. Let's do it. Let's start by getting things warmed up a little bit. Foam rolling the calf. Why the calf? Well, almost all the muscles that move the toes and all of the muscles that support the ankle and most of the muscles that support the arch are in the calf. And the ankle, aside from the bones, is really mostly tendons and ligaments. The ligaments that hold the bones together and the tendons that connect the muscles of the calf to whatever their attachment points are in the foot. Be that the Achilles tendon attaching to the heel, or the tendon of the long toe flexors and extensors attaching to the toes. So as you can see, my foam rolling has a couple of characteristics. One is it's pretty gentle. I'm not going for pain. And the other is it's a pretty nice pace. If we were just going to be foam rolling the feet, and that was the whole point of our session here today, I'd probably be going slower and maybe paying a little more attention to tender spots. Just make sure you get that inner arch, the center of the sole of the foot, the outer arch, and all the way up the calf, all the way up to right behind the knee. Just about a minute or two each side. And let's switch sides. I like foam rolling. I think foam rolling is a great way to release your own fascia. Inexpensive. It's quiet. I love percussors and massage guns. This is a nice quiet way to do it, and it does work. It does increase your circulation. It will make your tissues a little more pliable. It definitely does a lot for your sensation. And let's remember that our fascia is many things. It's supportive, it's strong, it's flexible, it provides passage for blood vessels, and gives shape to your body, but it's also sensory. It's totally filled with nerve endings and sensory fibers, and a big part of our proprioception, that's our experience and our sensation of our body position and movement, comes from the fascia. So a lot of what we're doing here when we're foam rolling is just creating sensation, waking up the parts of our brain that looks after the, in this case, the calf and the foot. Now that's done, let's just do some range of motion. Toes up, toes down, toes up, toes down. Technically, this is dorsiflexion, plantar flexion. Some people call this flexing the foot, pointing the foot, toes up, toes down. I use toes up, toes down because there's kind of no confusion about that. And we're going to go toes in, toes out. Toes in is inversion, toes out is eversion. Almost everyone is stronger in inversion than eversion. Almost everyone has more range of motion in inversion than eversion. That's the typical scenario. And now let's try to make some circles in each direction. Just a few, just getting warmed up. Cool, switch feet. Point, flex, point, flex, plantar flex, dorsiflex, plantar flex, dorsiflex, toes down, toes up, toes down, toes up, toes in, toes out. Notice that my hip and my knee are not moving. I'm not rolling toes in and out like this. My knee is staying pretty planted. The back of my knee is staying pretty planted on the mat. Most of the movement is really coming just from the ankle, inversion, eversion, toes in, toes out, toes in, toes out. Okay, we're going to switch gears now and do some toe raises. Really simple. Just get yourself supported by the back of a chair, and we're just going to raise and lower a few times. And when you lower, go back on your heels and lift your toes. So you're rocking back on your heels, your toes come up, then you roll back up onto the balls of your feet. We're not quite raising all the way up on our toes. We're just using the balls of the feet. And the balls of the feet, on each foot there's an inner ball and an outer ball. And we want to focus on trying to press evenly through both feet and in each foot evenly between the inner ball and the outer ball, so the weight distribution is very even from the outer foot to the inner foot and from left foot to right foot. For this piece, you're going to need a TheraBand or some resistance tubing. I like red TheraBand. It's kind of medium tension and resistance, and when you stretch it, it gives you more resistance. When it's not as stretchy, it gives you less resistance, so you really have a lot of control. Let's see how to use this to strengthen our ankle and arch supporting muscles. We're going to start by strengthening our tibialis posterior. So the TheraBand or tube goes around the sole of one foot. The outside of the ankle goes over that knee, and we're just going to wrap that TheraBand around the ball of the foot. And from here, the movement is with the foot more or less pointed down, plantar flexed. We're going to lift to the ceiling and down. Lift to the ceiling and down. You can see there's some activity in my toes. I do want to try to minimize that and really focus the effort on the inside of the calf here. If this is too much resistance, you can put some slack in your TheraBand. If you want more resistance, you wrap the TheraBand around that lower foot. That will definitely increase the tension, just like that. Toe toward the floor, toe toward the ceiling, and we really, again, want to focus on this line right here. You may feel cramping in your arch. You may feel some cramping in your calf. That's good. That means we're working the right muscle. But if it is cramping, it's totally okay to give it a rest. So I'm going to go for 6 more, and I want you to try for 12 to 20. 12 to 20 of these. That's our tibialis posterior, our main inverter, and a huge supporter of that internal arch of the foot, the medial arch. Now we're going to focus on eversion, and for this, we wrap the TheraBand around both feet, and only one foot is going to be doing the work. So again, with my right foot, I'm going to go from inversion to eversion. The left foot's not doing much. It's just holding the TheraBand down. If you want more resistance, stretch that TheraBand a bit more. You can see my toes wanting to be active. I'm trying to relax them. So we can really concentrate this on the outer calf. And I'm going to give myself 6 more. And we want to go for 12 to 20 of these as well. Great. Let's go for the other side. We're going to start with eversion of the left foot. Since we're already in this position, toes in, toes out, toes in, toes out. Watch for effort in the hip. Sometimes your lateral hip will be woken up here. Well, that's totally good because you got the foot in the air and it needs to give your knee and your ankle something to push against. So getting a little bonus abductor work, a little bonus gluteus medius work. Let's go for 4 more here. Now let's go for inversion of that right foot. So I like to wrap that around, give myself a good amount of tension. And here we go. To the ceiling, to the floor. Ceiling, floor. 3, 4. I see this. Work in the tendon that's coming behind the malleolus. That's the main bone of the ankle. That's where we want to see that tendon working. If you see this tendon working in the front of the foot, that's your tibialis anterior, and that's a good muscle to strengthen too. But today we're going for tibialis posterior, and I'm going to give myself 5 more. 1, 2, 3, 4, and 5. Well done. For this next piece, we're really going to focus on the muscles of the toes and the arch. And for this, we need an object about this big. It really doesn't matter what it is, just needs to be maybe an inch or 2. This is a piece of malachite, if that sort of thing interests you. You can use a crumpled up piece of paper. You can use like a nut or a bolt. You could use a walnut, peanut, it doesn't matter, as long as it's fairly firm and fits in your toes. Let's see how this works. You're going to place this object on the floor in front of you. You don't have to put it on a towel. I just did so you could see it, otherwise it blends right into my gray carpet. And you want to grab it with your toes, okay? Grab it and pick it up. So now I've got it. I grabbed it in my toes. I'm going to hold it while I circle my foot in each direction a couple of times. If you drop it, that's okay. Just pick it up and go again. Now that one was with these 2 toes. The next one, I want to do it with my middle toes. Grab it, lift that foot, circle. Oh, that is really hard. And it makes my toes want to cramp, but I'm just going to work through it. If you have to let go and stop, that's okay. If you find your toes cramping, I recommend you try smaller circles. The last one, we're going to use the lateral toes, the pinky and the ring toe, and make as big a circle as you can without dropping it or cramping the toes. Set it down. Whew. Let's do it again. We're going to do this 3 times each feet. We're going to do it 3 times each foot. Some people find the big toe and the second toe to be the easiest. Some people find them to be the hardest. Wherever you're at, just make some circles. Try to make them smooth circles and make those circles as big as you can without dropping your object or cramping the sole of the foot. Now you can feel this, I'm sure. So you can imagine that if you did this daily, or at least several times a week, that within a few weeks your feet would feel completely different, and by extension, your whole lower body. Whew, okay. One more time with this right foot. Grab, lift, clockwise 3 times, counterclockwise 3 times. Again, I'm trying to keep that movement that's called circumduction. Making a circle is called circumduction. Trying to keep that circumduction of the ankle to really be confined to the ankle. I'm not doing this with my whole leg. That's a different exercise. It's probably a good one too now that I think about it. And 3, 2, 1. Finally, the lateral toes. You already might be finding this easier than the first time that you did it. 1, 2, 3. I encourage you to go at your own pace. Of course, you can pause the video anytime. If you drop it, just pick it back up and keep going. Okay, left foot now. So for me, with my history of neurological injury to my left sciatic nerve, my left foot is always a little bit less good at whatever I'm asking it to do than the right foot. But for whatever reason today, it's doing pretty good. I'm able to pick it up and circle. 2, 3. I really feel that, ooh, in my outside of my foot. That is hard. And one more time here. So this is rep 1 of 3 with my left foot. Oh, I dropped it. Let's try that again. I think I got in my head about counting and I wasn't paying too much attention to my toesies. Oop, there it goes again. Maybe today all I've got on this left foot when it comes to these lateral toes is a pickup and maybe 1 or 2 circles. Let's see what I can do. Nope, I got it. And oh, isn't that interesting? I just felt my pelvic floor contract with the effort. Not necessary. And we'll put a bookmark in that for our next pelvic floor video. 2, 3 in each direction. These foot muscles are called the intrinsic foot muscles. They're called intrinsic because they exist only in the feet. They don't cross the ankle. And they do so much work for us to support our arch, make it springy and solid, but they also provide so much proprioceptive feedback. Remember, proprioception is our brain's internal experience of our physical body, our awareness of our movement and position in space. And so much of our brain, when it comes to proprioception, is keyed into what our feet are doing in relation to the ground. So we are strengthening and we are creating a lot of stability in our arch, as well as springiness and resiliency through the arch, which prevents so much plantar fasciitis, prevents so much ankle sprain, but also provides a really good solid base of feedback to the brain. There's my pelvic floor again trying to help. It can't. So much feedback to the brain about where we are in space. Okay, this is it. This is our last 3 circles, and we did it.